Good morning, and thank you for joining us for the first part of our four-part Fall Tuesdays at 10 series. Today, we'll discuss technology optimization and cyber risks for healthcare entities. We have three other webinars in this series focused on New York IDD and behavioral health providers that will take place on October 1st, October 15th, and October 29th, all at 10 a.m. Eastern Time. You can sign up for those at forbesmazars.us/events. Our presentation today will last approximately 1 hour, including a Q&A session at the end. If you have a question during the presentation, please submit it using the Q&A function on your Zoom toolbar. Before we begin, we have a few housekeeping items to go over. To receive CPE credit, please view the entire presentation and answer the polling questions as they appear on your screen. These questions will be spread throughout the presentation and will be available for approximately 20 seconds, so your attention is required. To ensure all polling questions appear on your screen, we recommend using a recent version of the desktop Zoom client and minimizing all other windows. If you're viewing this presentation in a group setting or group attendance sheets are available at forbesmazars.us. Finally, if all eligibility requirements are met, the compliance team will send your CPE certificate within 2 weeks via email. And with that, I'll introduce our two presenters today, Ray Baxter and Ben Owings, who are both part of our IT Risk Services team.
Thanks, Aaron, for the introduction, and welcome everyone. We appreciate the opportunity to be with you this morning. This is our second time presenting at the Tuesday at 10 series. We did one last year on a similar topic around cyber risk. We know how significant that is. But we did want to bring an additional topic to the presentation today, and that is where we'll start around technology optimization. We're going to start by defining technology optimization, what we at Forvis Mazars believe that means. I think there's a lot of different components to optimizing your technology, but we want to really identify what key components we see or we assess when we're looking at optimizing technology for our clients. But also ways for that to be very cost effective for organizations and potentially even save costs in certain situations across their IT landscape. Before we dive in, though, we want to really kind of kick this off by looking at some recent events that have taken place across the industry. Many of these in the past, 6+ months, or certainly within this calendar year. There's been two major, system breaches or organizational breaches that have had a significant impact on the healthcare industry that I think we're all aware of. But those are really just the tip of the iceberg, and we've seen a lot of, disruption across the industry, not only this year, but in several years in the past. And we'll talk through some of those statistics in more detail, but. I would imagine all attendees on the call have seen examples or similar stories to these. Maybe you or your organization has faced some of this disruption firsthand that has taken place this year and beyond. And so just really thinking through not only how that impacts your organization, how that impacts the industry as a whole, but certainly with kind of keeping that key focus on our patients and patient care. And really that being the cornerstone of our organizations and the way in which we serve our communities. I think it's really important for us to stay very focused on cybersecurity and make sure that's very top of mind for our organizations.
And we can't probably not talk through a little bit about United Health or Change Health, which is probably the largest and most significant ransomware attack and data breach that has occurred in history. And I would assume a lot of individuals that are on this webinar today probably have been impacted by that attack. United actually just declared that they're right now looking at that ransomware data breach will cost them over $2 billion. And a lot of that is not only are you making the headlines, which is now causing reputational risk, but as a third-party vendor to many other health networks, there's going to be a lot of lawsuits, regulatory requirements, and fines that are also going to occur due to that data breach.
Absolutely. So a quick agenda for today. Again, we'll start with technology optimization and define what that means, give you some examples of benefits of looking to optimize technology. We really want to bring that full circle with a case study, a real example that we experienced serving a client with technology optimization services. And then we'll shift to some general risk management, which I think will support the cyber risk component of the presentation today. We want to really identify what key programs are out there that organizations can, implement internally or utilize relationships with their consultants to implement. If you have implemented a risk management program, what are some best practices to be able to improve that or to make sure that, that function or that effort doesn't go stale? And we talked a little bit about some trends, but we do want to look at some statistics across the industry. I won't bury the lead here, and I'll go ahead and say that the healthcare industry is the most impacted industry consecutively for the past 14 years. When you look at the cost of data breach, when you look at the overall victimization of the industry. And so, we hear some of these Regents events, and, Ray mentions change, and we know about other organizations that have been impacted. But this is not a new trend or a new risk or concern for the industry. And so we want to make sure that we don't view it as such and think that maybe the target on our backs are new or something that may go away here in the near future. There was some preliminary data that came out from very reputable agencies and organizations, towards the end of third quarter, beginning of fourth quarter of 2023, that indicated that the education industry or sector may actually, for once in the last 13 years, would top healthcare for 2023. But we've now got the data, and that's been released, and that was proved to not be true. Healthcare is still on the top of that very, very unfortunate list. So we've got some questions here that we'll answer today. I don't think we need to spend much time here, really just kind of flipping the agenda around to some things that we're going to discuss and define today. Let's talk about technology optimization first and foremost. And so regardless of the organization that you're working for, I know most attendees are working for covered entities, and we know how complex your technology environments are, right? There's a lot of clinical systems, there's financial systems, there's operational systems and platforms. Your IT departments are likely utilizing tools and solutions to be able to support the organization, not only with data transfer, but with security and privacy measures and mechanisms. And when you get into technology environments that are that complex, I think it is very important on a regular basis to look for ways to enhance that technology, but also to optimize that technology. And so the first benefit of technology optimization is to look for areas for process improvement. Really, what are efficiencies that can be created and utilized throughout your technology? And so what we want to do when we're serving clients in this space is really look for opportunities to, figure out what their processes are and what maybe a data flow diagram looks like. What are some key job functions for really, key areas or very important functions of the organization, and start to identify ways that we can look to improve those processes. Creating efficiencies is always going to be beneficial. Looking for areas of waste or, delays or concerns in the technology. Maybe it's in the way that they interface. Maybe, we look at bullet point 5 there, reducing manual processes. And so maybe that's a concern of, hey, we have to have a lot of manual intervention or manual workarounds that take place. And that's certainly not helping us create efficiencies. And so we want to look for those key areas as well. Reducing cost is an interesting way to look at any sort of technology assessment. I think, we all historically or traditionally look at information technology departments as cost centers for your organization, and they certainly are. I don't say that in a negative light. They're a very important function and they're a very deserving cost center. But typically when we're looking at evaluating or assessing the technology for our organization, that is going to potentially increase costs because, we need to, enhance that technology. Maybe we need to purchase more technology. Maybe we need to perform some sort of upgrade or conversion to that technology. But first and foremost, I think, when we're looking from a cost perspective, at technology optimization, we want to look for ways to reduce cost. And so, do you have shadow IT that is costing the organization more money because it's putting more of a burden or more time and materials into that sort of function? Do you have two different applications that are performing the same, core functions, and you really don't need those? You can kind of streamline and consolidate those into one. Do you have ancillary systems that you're utilizing at other locations that you can bring onto your centralized electronic health record or your centralized billing system or billing function? And so it's really good, I think, and important to look at that and make sure that we are streamlined as much as possible. We are functioning at kind of that baseline of what do we really need? How do we need to protect it? And making sure that that all matches and aligns with the size and complexity of your organization. A lot of what we see is IT departments are utilizing tools and solutions that may be, have all the bells and whistles. It may be the new cool thing that organizations are implementing. But if you are a smaller organization, you may have purchased a tool or solution that goes above and beyond what you need from a security perspective or from a monitoring perspective. And so we want to look at that as well and right size that and make sure that any contractual components or relationships that are involved in that from a vendor perspective are accurate and that organizations are getting what they pay for.
Hey, Ben, I'm going to just give a couple of examples of some of
Yeah,
what you
please.
just mentioned with
Please.
things that I've seen that worked in the past in my past roles, but also some of the things that other companies have done. One of them I know that Ben mentions application rationalization. I think it's very key because of the amount of applications our healthcare environments have, looking at an inventory and then looking at ways to consolidate. Part of that consolidation is also vendor consolidation. When you start reducing the amount of vendors you're using and utilizing software by maybe a handful of vendors versus 40 vendors, you're going to see cost savings that can occur within that. And one of the easiest ways to start determining what you're paying for each one of your vendors and software is on an annual basis, having each one of your departments, especially within IT and security, do a bottom-up budget. And that bottom-up budget helps you start analyzing the spending per vendor, understanding what is your OpEx spend, what is your CapEx spend. It also can help determine if you have multiple different locations. Is there a corporate versus hospital cost or a corporate versus clinical cost? By doing that type of easy task on an annual basis will really help you get a better view of where there can be some cost savings around the applications that are being utilized. And I think that one of the biggest things, and Ben mentioned this too, is we all love the shiny object. What is the coolest tool that's out there? And we want to purchase that. But I think, especially with how tight the margins are with healthcare, we do have to probably buy the Cadillac solutions in some aspects, especially with the amount of ransomware and cyber attacks. But that's not always the case. You can easily buy the Kia for certain areas, but you really have to understand your risk profile and understand what risks within the organization is most concerned for you and your security team, and understand where are those areas that maybe we need to put a little bit more spending in, but there's definitely going to be areas where you can reduce that spending.
Well said. All right, and then just taking it a step further of optimization and why is this important? And again, knowing that patient care is the cornerstone of our organizations, we want to start there. And so, improving clinical outcomes and facilitating care coordination, I think, really go hand in hand. I think starting at consolidation of technology or optimization of technology, if we're taking this all the way through kind of the overall assessment and implementation of that optimization, is going to be continuity of care. And so if we're kind of breaking down these ancillary systems, if we're consolidating and centralizing our protected health information, electronically and having access to that across the board, then I think that's going to improve that continuity of care. I think it's also going to just create those efficiencies that we were talking about. And so making sure that we don't have kind of that manual workaround processes in place, that we can utilize the technology in the way in which it was designed, and we can really take advantage of those functionalities and capabilities of the technology. And a lot of what we see when we're performing these types of assessments, or when we're talking through and maybe just providing some, advisory support to organizations that are performing these internally, is a lot of times, we are having recommendations as simple as, well, we don't believe that your workforce has been trained adequately on some of the technology that you're utilizing. And so in order for them to perform their day-to-day job function, they have had to develop their own manual workarounds. And so a lot of times the blame gets placed on the actual technology to say, well, it doesn't have this capability that we need, or the functionality for this particular workflow is not there, when in fact it is, but there was just not proper training to take place. And a lot of times, if this is a vendor managed application, or vendor serviced application, then you can go to that third party and request additional training. A lot of times that's going to be complimentary, depending on the vendor and the situation and the contract. But those are things that you can work through internally as an organization, or certainly Forvis Mazars or probably any other consultant can support for you. But just thinking through some of those concerns, some of those nuances and complexities that are introduced by the use of technology, but certainly by the use of multiple technologies across an organization. And so I think it's so important to really look to that piece, start from the clinical aspect. How do we use this technology to provide care? And how can we do that more efficiently and really enhance that the use of that technology and how it runs in parallel with our day-to-day jobs. We talked about cost savings and reallocation. I think that's a key piece of this, and an area where we want to focus on. We want to provide our clients with ROI when we're performing an assessment, and every chance that we can. And that's not always possible. That's certainly not something that Forvis Mazars or anyone else would guarantee until we kind of dig in and look at what the technology landscape looks like. But there have been many examples that we have been able to support organizations with cost savings, or at least cost reallocation to other areas of the IT department or of the business in itself. And I think that's a huge value add.
And one of the easy, go ahead, before you start with that,
yeah.
We were working with a healthcare organization and looking at that cost savings and reallocation. One of the simple things that we were able to determine, and it's probably very easy for a lot of organizations, is your printer cost. They were able to run a scan and determine that there was probably about 15 to 20 printers that were only being utilized around 10% of the actual period of time. And so it was an easy kind of report to look at and say, do we really need to be paying the annual fee for these printers? Another area too is data cleanup and retention. You save money by storage, but then you also have better data loss prevention because you have less data. Most of our organizations love to save data for 20 years. And I think we're shifting from a cultural standpoint to really getting people to realize that you do not need the Word document or PowerPoint or patient record that was from 20 years ago. Understand that there's legal holds and there's regulatory time frames that need to be put in place, but retention is definitely another area that we've seen savings that occurred. And what it allows is you have these savings from simple things like printers and data cleanup, and you can shift that money into another area to better serve the organization and serve your security department.
Fourth bullet point here is interoperability. I know that's kind of a newer buzzword across a lot of organizations, but especially within healthcare, and really, again, trying to making sure that technology is utilized together, and that we have kind of a nice harmony with all the technology that organizations are utilizing. A lot of times that's difficult to do if you are trying to blend new technology with more antiquated technology or antiquated applications and systems. But there are certainly ways to look at that and evaluate that and start to identify some areas for really driving and improving interoperability. And then finally, reducing human error. I think it's, certainly goes hand in hand with the reduction or identification of what the manual processes are that organizations have in place across different functions and departments. And so anytime you're, utilizing technology, you've kind of tested and vetted the, data integrity components of that technology. The more you're reducing manual processes, the more you're going to reduce human error. And so I think that's a big value that we're seeing, especially in our clinical areas and especially in our financial areas as well. So here's a case study that's hopefully going to help kind of bring this concept of technology optimization to life. I don't read out loud very often, but I guess I'm going to do it here, so bear with me. So we had a client recently whose chief information officer left the organization due to retirement. The organization, a very small community-based hospital, did not want to replace that position due to some financial constraints, but the chief financial administrative officer just came to Forvis Mazars and said, look, I think we're doing the right things. I trust, our IT director and all the individuals that are working in that department, but I know nothing of what is really going on over there. Our CIO was always my conduit. They had worked together for decades, and so there was just that inherent trust that had been developed over time. But he felt like he needed to know what was going on. And his exact words were, I need to know the lay of the land of my IT department. And so we was really kind of the foundation of us developing out a approach and scope to this type of assessment. We decided to perform for them, or at least assist them over the capabilities of their technology, solutions, tools that they were utilizing from an IT perspective. Start to look for some very obvious concerns like outdated or unsupported, operating systems or, devices that were not, being updated or, things that had not logged onto the network in a certain period of time. And so start to look and really that quick kind of hit of, hey, here's some low-hanging fruit that you can start to address very quickly and start to take care of, and that we can start to develop out some IT prioritization or IT projects around. We also did a little bit of cyber technical work with some network enumeration to really give them kind of a head start on inventorying and asset management pieces of this. We then wanted to perform a vendor assessment. Being a small organization, they do have a lot of key functions that were outsourced. And so we wanted to assess those relationships, but also look at and evaluate the contracts that they had in place with those vendors. And there's a lot of reasons that you do that. One, to make sure that they're in compliance with, everything related to business associate agreements and contractual agreements from a regulatory perspective. But also to really look at, service level agreements and contractual agreements to make sure that the organization is first and foremost getting what they're paying for. Two, they're not overpaying for what they're getting. And three, to make sure that the vendor is being held accountable for reporting on whatever function they are required to do based on the contract. And so we want to make sure that, the organization, that vendor relationship is, certainly ethical, but we also want to make sure that the vendor is honoring that the organization is getting the support that they need, or the response times are matching up with what is agreed upon in the contract. And so I think it's really important for us to take a very deep dive into those contracts and really do an assessment around those for more detail and more information, and really to protect the organization. I would say those two key areas are probably going to be our main focus in that cost savings and cost reallocation space. Now, the people assessment could be, but we certainly don't look for opportunities to come in and immediately request that organizations downsize their technology department. But we do want to assess leadership. We do want to assess reporting structures. We want to make sure that resource allocation is appropriate. We want to also look at a potential vendor component or relationship as a part of the people assessment as well. We have a lot of clients that maybe outsource an after hours help desk or outsource some contractual labor or development related labor. And so that is going to have a vendor assessment and contractual evaluation, component to it as well, but it's really going to fall under that people piece as well, because we're looking at that from an HR perspective and really evaluating that at the departmental level. So really capturing those three components is going to be critical for kind of the strategic direction and reporting that is going to be the outcome and really going to drive the deliverable phase of a technology optimization assessment. And the goal here is to be very practical. We understand that organizations can't take a list of 8, 10, 12 recommendations and typically implement those in a 90-day period or even a 6-month period. And so we want to help organizations prioritize the most important or the biggest area, the biggest recommendation that carries the most risk, and start to really, make progress towards a corrective action or an implementation to really drive that desired future state of the organization from an IT perspective or security perspective or compliance perspective. And so depending on what kind of category and bucket that falls into, I think it's important to focus on that to make those as practical as possible so the organization can move forward. A lot of times any sort of assessment that's going to be IT related is probably going to produce findings and recommendations that could be seen as overwhelming. And you get a list and you get a report of a lot of different things, a lot of different information, different perspectives, a lot of, driving of, hey, this is best practice. You really need to get to this level as quickly as possible. We have to identify findings and provide recommendations. That's a part of our role as consultants or a part of any sort of internal assessment that your organization may perform. But we try to make it as practical and as actionable as we can, rather than kind of being this overwhelming task and overarching responsibility that organizations need to take on immediately. And so I think that's been beneficial, the way that we've approached this, or we've encouraged organizations to approach it internally.
I think a good point, Ben, on that is yes, this is around technology, IT, and security, but there definitely needs to be alignment with the entire organization. And what you want is to ensure that security and IT has a good understanding of what is the goals and initiatives of the organization as a whole, and making sure that those are aligned and coming up with that 1, 2, 3 year roadmap, because it is not all going to be able to be fixed over a week or 6 months. Some of these types of initiatives take time. Some of these cost savings initiatives take time. But the more that the business and the executive teams are aligned with technology and security initiatives, are really going to help significantly in this process.
And just very quickly here, I mean, there's certainly going to be a discovery phase component of this, right? You want to either learn your organization more deeply from a technology perspective if you're performing this internally, or you're going to want your consultants to do a significant amount of discovery to make sure that they understand really kind of the full lens into the IT department and its key functions. Communication is going to be a big key that really spans across all of these phases, but thinking about kind of starting to communicate what the plan is going to look like, starting to communicate findings and recommendations as you're building out the reporting function of this and developing deliverables is going to be very, very key. And so making sure not only are you communicating frequently, but you have very detailed, transparent communication, you have very open and honest communication, with the members of your organization that you're working with. And again, this is all to benefit the organization and provide value to the organization. And so we certainly don't want there to be any hesitancy for individuals or key stakeholders to open up and explain either areas that they're struggling with, or things that they're unaware of or they're not quote unquote experts in, and really start to identify areas in which they can look to drive that process improvement piece. And then continued support, I think, is so key. We're never fans or would never recommend an organization performing an assessment and not having some sort of continued support from either the group or the external consultants that has performed that for you, because their perspectives may not be your perspective, or their interpretation may differ from yours, or there may need to be clarification into what this recommendation actually means and how we can apply it and implement it into our IT department. And so, having that continued open communication and support mechanism, I think, is very, very key. Here's a little bit of an analysis, just some takeaways from the assessment that we showcased in the case study there. There's this conceptual focus on operational IT for a lot of organizations. I would argue that that is the correct thing to do, right? We need to make sure that operational IT, quote unquote, keeping the lights on, supporting those day-to-day functions is number one, because that's how we care for patients better. That's how we support our providers and clinicians in the best way possible. But it cannot overshadow cybersecurity to the point to where cybersecurity is not on the list of priorities. And so if operational IT is one, from an IT perspective, then I think cybersecurity has got to be two, or at least in the top three. And so we can't continue to kind of utilize the excuse of, well, we're so busy with end user support, or we're so busy with access management, or we're so busy going out on help desk calls and deploying resources to support end users or support the workforce, that we're not focused at all on either cybersecurity related assessments, risk related assessments, or more importantly, if you're having those assessments performed, whatever those corrective action plans state, whatever those recommendations are, there needs to be some sort of focus on progress towards either implementation of mitigating controls or full remediation of whatever the gap or the concern is there. I think that goes, directly into the next one on the right there. Lack of financial and people resources was an easy excuse. I think it's a legitimate excuse in a lot of ways. And again, I don't say that negatively, but again, it can't just be, well, we don't have the money and we don't have the people to be able to do this. A lot of these do take a little bit of time, which is certainly going to impact people resources, but there are ways, again, to develop very practical approaches or steps to take to drive that improvement that we're looking for, or to improve the overall security of the organization. And so, we're not coming in and recommending that, hey, you need to go out and spend an additional, $1.5 million on IT solutions. It's more of, hey, you have this functionality here, you need to enable it, or hey, you need to monitor this more closely, or hey, instead of devoting X number of resources to end user support, can you pull a resource off and have kind of a partial FTE function that's focusing on IT projects and corrective action plans? And so these are things to where it's more kind of reallocation or repositioning of current resources, whether it's financial or people, to try to implement some of these process improvements. Now, there may be a situation where you have technology that is so outdated or is insufficient in the way in which it's supporting the organization and its goals and objectives, to where new technology would be the recommendation, but we're also going to build out and help support a cost benefit analysis and a capital planning function to be able to support that through the organization and get that to leadership as well. Self-reflection is hard, and that's a theme that we see across a lot of our assessments. And we have a lot of IT leaders that we interact with that are very confident in what their organizations are doing or what their departments are doing and how that department is supporting the organization. A lot of times it's difficult to get them to maybe take a step back and look at it from a different perspective and say, hey, you are doing a lot of the right things, and you do have a great team and great knowledge and great support and a great approach to what you're doing. But, here's an area where we believe that you can find, improvement, or we think that you can be more efficient in this area. And so, organizations being open to that, or, specific leaders being open to that sometimes can be very difficult. Sufficient knowledge and experience already exists in a lot of these organizations. And I think, kind of back to my main point of, organizations in a lot of ways are doing the right things, or at least have the right intentions in place. I mean, very rarely do we go into an organization and perform one of these assessments and think, well, they don't have the knowledge, they don't have the experience, they don't have the right resources at this organization's. It's more about kind of finding the right placement, the right path, the right job function for the resources, and kind of those members that you already have in place. Sometimes we have individuals with a certain background that are performing a different job function because it's what is deemed to be needed within the IT department at the time. But is it really the best fit for that individual? Does it create efficiency? Does it help with turnover? And again, as Ray alluded to, and as we've mentioned a couple of times, right, we've got to keep the mission and the goals of the organization at the forefront of some of these conversations. No news is good news. Proverb still exists. I think this is an interesting thing to kind of think through. And a lot of times when we talk to organizations and they're seeing all of the disruption across the industry, their first thought is, well, we haven't had a major security incident, or we haven't had a breach. We haven't been impacted by ransomware. We haven't had any sort of insider threat that's caused a major concern, or caused any disruption for our organization. And I think the follow up to that is they think because of that hasn't happened, or because of that fact, is that they're doing all the right things, and that very well could be true. But you don't know that, or there's really no true comfort around that unless you're having some sort of assessment performed to look at risk, to assess compliance, to review your technology enablement and optimization. And so, we encourage organizations just to not, take that no news is good news thoughts, or, that current state, and think that that's always going to protect the organization effectively.
And so why a lot of this is so important, and why we definitely need to continue to shift our thought processes around the technology solutions and tools that we're using, is we can see the cost of data breaches, including ransomware, has increased year over year. Unfortunately, healthcare has been the highest cost industry for 14 years in a row. This is a source from IBM. IBM does a great article on an annual basis that they pull information from a global standpoint around organizations. And you can see that that average cost of a breach for healthcare is 10.10 million. In 2022 has increased. In 2023, we're already seeing an increase that's going to occur in 2024. As we've seen the evolution of technology, which has been a great thing for a lot of our organizations, unfortunately, these bad actors or hacking gangs or groups are also utilizing this types of technology. Unfortunately, this is not the guy in his grandma's basement wearing a black hoodie that's trying to attack your company. These are very sophisticated groups of individuals, 100 to 200 people that are government funded, usually by the government of Russia or China or North Korea. And that's why we're seeing an increase of these types of attacks and the overall cost of these attacks. 200 days of an average time to identify and contain a data breach. A lot of that is it's 200 days because they are in our systems, looking and monitoring our systems without us knowing. And what they're trying to do is understand the financials, understand what is the most critical system that they're going to go ahead and hold ransom. So For healthcare, a lot of times that's going to be your electronic medical record system, because they know if they put that through ransom, it's going to cause significant impact to the operations of the organization. The other thing that they look at is your cyber liability insurance and your financials. So when they do request the ransom, they want to have a good understanding of what kind of cash you have on hand. What are you going to receive because of your cyber insurance? So the ransom that they request, whether it's 5 million or 10 million or 1 million, is going to be an amount that they feel that the organization will actually pay, because at the end of the day, they want to ensure that they are receiving that financial gain. And the last piece, and I know Ben mentioned this, and this is why all organizations really need to stay proactive, is 95% of organizations have had at least one breach. This is probably within the next 3 years going to be at 100%. It's not if, it's when. And it's making sure that we have the right controls in place to ensure that we're protecting the critical data around patient health information. And you'll see too, in the box to the right, there is a higher cost of data breaches in highly regulated industries. And a lot of that is because of the Office of Civil Rights and the HIPAA requirements and the Attorney General and different other areas that we see within the healthcare industry and the financial industry of fines that occur after these types of breaches. So one of the easiest ways that we have been seeing these types of attacks occur is through email compromise. Overall, the FBI has significantly got a lot more complaints over the years, and we are seeing a lot more business email compromise and email account compromise occurring. What this is usually it's around phishing. The phishing attack will come into the mailbox. Great example is you're the employee of the month and you're going to click on this link and it's going to take you to a fake page that looks just like your company's intranet page, and the end user goes and logs in. We're seeing a lot of attacks really coming because of end user error. The human element is a key factor. And that's why education is very really needs to occur to our organizations, is ensuring that we're educating our people. And so the other thing that, every cyber group or conversation we're having is talking through AI. So artificial intelligence is also allowing individuals where English is not their native language. We've been trained for the last 5 years that if we look at grammar issues or spelling issues, that we ignore that email because it's probably a phishing email. Well, now these hacking groups are actually utilizing AI to develop the emails, which is making the emails look a lot more realistic. And so we do have to have better education for our end users to be able to determine these types of bad emails and phishing attacks. So being prepared through best practices. Let's go jump in the bottom right, email security and awareness. We're just talking through that. And more or less it's the phishing and spooking emails, but now we're also seeing texting and voicemails. And then we're utilizing deep fakes and seeing that there are videos of executives that are able to create through Zooms. So this is not changing. It's continuing to get more sophisticated. They're starting to get more and more ways of doing this better. But implementing training and awareness programs and including regular phishing simulation exercises is definitely key. It's more or less having a fake email get sent out on a quarterly basis and having your end user group really determine whether that is a true email or not. Hopefully they report that email. And if they don't, they'll have to go through a 30-minute security training, just so that they could get better understanding around that and around what to be looking for. Incident response plans is key. And again, this is back to it's not if, it's when. And the incident response is really making sure that you have good plans in place to really outline overall what to do when you have a ransomware or data breach. Certain things that organizations should have decisions already figured out. They should already have the answers to a lot of the questions before you're in crisis mode. One of the easiest ways of doing this is a tabletop exercise. And it's really just getting the executive team in a room together and going through scenario-based situations and making sure that the group understands certain types of processes that occur when a data breach or ransomware attack occurs. Some of the easiest things to really just focus on is who's going to be the one that's declaring this is a crisis or a disaster. Are we going to pay the ransom? Do we have the ability to pay the ransom? What's our communication plans look like? When do we communicate to our patients? When do we communicate to our employees? Who do we have to contact? Is it the FBI? Is it our cyber insurance policy broker? Is it our external counsel? Do we have the contact information of all those individuals? So it's really just an easy way to outline and give yourself a lot of data points that you already have the decisions made when you're in crisis mode and not having to figure out the decisions to eliminate some of the overall impact that is occurring. Backups and recovery, very crucial. One of the easiest ways to mitigate a ransomware attack is your server goes ransom, you unplug it, you get a new server, and you restore it from backup. Where people have issues with that is backups really need to be on a different network, because if a bad actor gets into your network, what they're going to do is they're going to put the ransom on the actual server itself, but they're also going to put the ransom on the backup. So by segmenting the backups on a different environment, like a cloud environment, will help prevent them from going ahead and doing that. The other thing is are your backups and recovery working? Do you test your backups to ensure that the backups can be restored? How much data are you going to lose from the backups? Things to go through to ensure that you're going to be able to restore that system as quick as possible, making sure that you're following the different ROIs around that backup and recovery. And configuration hardening is one of those that it needs to be a daily thing. Making sure that security and IT is continuing to patch, but also continuing to review the different configurations and how they can make each of these different systems, applications, firewalls stronger and stronger. And a lot of this does occur during software upgrades and patching, where there will be additional functionality that allows your organization to protect itself even more.
So if your organization is new to its risk management journey or looking to enhance its risk management journey, we just wanted to identify really what we view as kind of the key components to that, or at least kind of the key progression to an effective risk management plan. You know, there's a lot of different organizations, size, complexity, the technology that you utilize, the responsibilities that you have or requirements you have from a regulatory perspective. And so, you know, we're going to start with really understanding those requirements, but also understanding and identifying your risks. And so we encourage organizations to start with functional areas of the organizations or key areas of the organizations. And those areas can be as broad or as specific as you want them to be. If you want to focus specifically on information technology, then those areas may be a little bit, the list may be smaller. If you want to focus this more on an entity level or organization-wide risk management process, then it's certainly going to be a lot of different areas and really encompass all departments. But starting to understand and identify those risks and those key areas. And, what we see a lot of times is those key areas are help desk. The key areas are key applications. The key areas are human resources or the security department or the privacy office or procurement or contractual management, whatever the different group is. We want to start to identify some of those key areas, and then based on that department, we want to look at what the inherent risks are. And so this is not taking into consideration really any sort of preventative or detective measures or controls that your organization has in place, but based off your size, your complexity, your geography, all of the factors that make your organization what it is, what are your inherent risks? And so all of you being in healthcare, one of the immediate top of mind inherent risks is going to be HIPAA, right? HIPAA compliance, maintaining that compliance, protecting your PHI and EPHI. And so that is going to be kind of that immediate inherent risk that your organization has is maintaining that. Then you're going to assess, well, what sort of risk mitigation, what controls, what projects, what efforts, what resources do we have in place to lessen that inherent risk? And that is going to give you the calculation for what your residual risk is. And so inherent risk from a HIPAA compliance perspective for a health organization is going to be, if 5 is your highest ranking, it's going to be a 5. It's going to be a critical risk or a high risk for your organization. But maybe you have great resources in place. Maybe you have a compliance budget. Maybe you have an internal audit function that supports, regular checks on HIPAA compliance. Maybe you also have external consultants that perform an annual assessment, not only a controls-based assessment, but a cyber technical assessment, penetration testing, vulnerability scanning, and those key pieces. Maybe you have great incident response plans and processes in place, and you're testing those. Then your residual risk may be a 1 or a 2, right? It could be low, or it could be maybe slightly moderate. But you're going to be able to lower that residual risk significantly based on those controls and practices that you have in place. But maybe those controls and practices aren't as robust or aren't as formalized as the ones that I just mentioned. So maybe your residual risk is a 3 or a 4. Those are areas that you would want to start to identify and really develop out process improvements or corrective action plans around. And so knowing those, understanding those, being very real and transparent about those, and then really start to identify who are our risk managers going to be, who's going to have the assigned responsibility for lowering this residual risk, and continue to provide awareness to those key stakeholders, but also members of your workforce, and then defining what that risk response is going to look like. And so you've identified the inherent risk, you've looked at the controls, you've assessed the residual risk, you've identified who's going to be responsible for that, you've made individuals of your organization aware of what's going on and what your concerns are, and then now it's time to develop the response and whatever that's going to look like. So we encourage organizations to really follow this path. Again, a lot of different ways to drill down into these key areas or key concepts, but I think this is a great blueprint for how to either develop a risk management program or to enhance the current risk management program that you have in place. I think this is very important to touch on, and we see that risk management can be very reactive in healthcare. I think it's important to acknowledge that other industries or other regulatory requirements require organizations to proactively report out on compliance on an annual basis, or to maintain a specific certification or a certain score on a particular assessment. HIPAA does require organizations to perform a HIPAA risk analysis or HIPAA risk assessment, but they're not coming around and doing proactive checks into whether or not an organization is doing that. And so you would really only need to prove that or showcase that if your organization had an incident and you had a regulatory inquiry or regulatory audit from the Office of Civil Rights. And so it just creates this very reactive nature to the way in which a lot of organizations approach risk management or approach, kind of assessing their compliance program and making sure that they are in compliance or as close to being in compliance with HIPAA regulations and requirements as they can be. So implementing a proactive approach, we touched on it a little bit in the risk management steps, but I think first is starting with a risk analysis. Really being able to identify what your risks are in your organization, inherent and residual, and then start to develop out, well, how can we start to lower those risks or mitigate those risks? A lot of good way to do that is to take those risks, take a HIPAA compliance assessment. The OCR has their own audit protocol. NIST is another standard and framework that we utilize a lot that has a HIPAA focused framework and set of controls that you can utilize as well, and take those, understand what your key areas are, what your key risks are from your risk analysis, perform that compliance assessment, but maybe put a little bit more scrutiny or a little bit more focus on some of those key areas where you believe you're weak from a risk perspective, or you have more risk than you should have, or you would like to have based on your organization's risk appetite there. These two pieces, I think, are critical. We encourage organizations to do some sort of cyber technical work as well. But I think understanding risk, assessing risk, and performing some sort of compliance assessment or just more in-depth risk assessment is going to be a great way to start on a proactive risk management journey for all organizations. So that is the conclusion of the presentation today. I do want to leave this slide up just for a few moments for you all to either jot this down or capture this information. If you have any questions or concerns about the CPE component of this, I know Aaron mentioned at the beginning that you will get an email confirmation within 2 weeks. And so be on the lookout for that. But if you have any questions, certainly send us an email and let us know. We do have a few minutes left for questions. So happy to take those. I don't know if there are any in the chat. Aaron or Olivia, do we have anything?
No, not right now.
Okay. Anybody want to come off mute and ask a question or talk through anything?
I believe we do have that disabled, so all questions were sent through Q&A, and either Olivia or I have already answered those. So anyways, thank you, Ben, and thank you, Ray. Thanks to everyone for joining the webinar today. As mentioned, you will receive the presentation materials via email within the next few days. If you want to learn more or have further questions, you can reach out directly to Ray or Ben, whose contact information will be in the handouts you receive. As a reminder, we do have 3 upcoming webinars in this series focused on New York IDD and behavioral health providers. And those will take place on October 1st, October 15th, and October 29th, all at 10 a.m. Eastern Time. You can sign up for those at forbesmazars.us/events. Additionally, if you're not already signed up for our Forbes Mazars foresights, you can receive notices about more webinars like this one, along with articles, white papers, and live events specific to the healthcare industry. Sign up today at forbesmazars.us/subscribe. And finally, just a few CPE reminders. CPE certificates will be emailed within 2 weeks. If you have questions regarding CPE, please contact our learning and development team at cpecompliance@us.forbesmazars.com. Thanks again for attending our webinar, and have a great day.
Thanks, everyone.
Thank you.